Hey everybody, Nikki Burnett here with Taste Life Nutrition. I'm a functional nutritionist and I practice strategic evidence-based consulting. I had a question not too long ago that I thought that I would share because I feel like sometimes I feel like that not everybody maybe gets what I'm talking about. And I've been told that a few times that I'm saying things and not everybody understands. And so something as simple as inflammation. I had the question, what is inflammation? And it made me sit back and think, and like, well, I know what it is, but how do I like describe it? How do I let somebody visualize and understand what inflammation is? Because it's sort of hard to understand. When we think of inflammation, we think of, well, we cut ourselves and it's red, or we break a bone and it's swollen, and all of these things. But when it comes to systemic inflammation, what does that mean and what does it look like? So I thought I would talk just a little bit about that. But first I want to give you the definition. It's a shortened version of the definition of inflammation. So at least you have that. And then we'll move on from there. So the definition is part of the complex biological responses of the body tissues to harmful stimuli. So inflammation is a whole cascade of events that go on in the body when there's something that needs to be addressed. So if you've heard me talk in the past, you've heard me talk about cell danger response. And so the cell danger response, is that a response to inflammation? Is the inflammation a response to the cell danger response? You know, I think really when we look at it, so many things are connected. We are not bits and pieces of a person, we're a whole person, and everything is connected. So I think that it would probably be both, you know, and it depends on the person as to what starts what. And that's part of my job, is to find that underlying issue. Let's find what's causing the inflammation or the cell danger response or the multiple things that might be causing this. So let's talk a little bit about acute inflammation. So acute inflammation is usually what we think about when it comes to inflammation. We think about, like I said, we cut ourselves, or we break a bone, or we have an accident, we bump our head, like I did the other night. I still have a bruise on my eye from bumping my head. That was a wake up. Anyway, so acute inflammation, like bumping your head, and you still have a bruise, there is a cascade of events that happens in the body that rushes to that area to create healing and to help the body to heal. And so it's a normal, natural process. And then you have the anti-inflammatory components of the immune system come in to help squash that fire. Because literally, I think you can think of inflammation as a fire. And so acute inflammation might be a lot of times a bigger fire. You know, it's a big fire and you can feel it and you see it. And the body has to come in and squash that fire. But the fire is there for a reason, right? Because something happened and it's trying to get our attention. So what happens then if we have chronic inflammation? And we may not know it because it's a much lower level fire. It just sits there and it burns and creates problems, and we don't listen. We don't listen to the cell danger response that's going on. We don't listen to our body telling us, there's a pain or there's an ache or there's something like, oh, it's age. Oh, I'm just unlucky. Or it's just my genetics. You know, things like that. It's our body trying to talk to us. So if we have this chronic underlying burn, essentially burn, it is a process that the body is going to of a constant regeneration and dysfunction or breakdown of tissue. So wherever the tissue might be. So it's this constant battle between trying to regenerate and get healthy, and the tissues, your body's trying to get healthy, to a consistent breakdown. And so this inflammation just in time or this fire will grow and grow and grow. So we want to take a step back if we feel a pain or a problem, or if we end up with some chronic condition, something's going on. And we have to be aware of that and listen to our bodies. We can't blame it on age. We all are going to, pass in time. We can't avoid that. But, living to our fullest while we're here, it's not about extending life. I mean, that's great and all, right? But it's not about extending life. It's being able to live into your 80s, 90s, however long you can live, however long we do live, some of us less, some of us more, walking, exercising, enjoying family, enjoying friends, eating out, all of the things that we love to do, playing with the dogs. I got a new puppy, by the way. Hey, Tanya. And so understanding and paying attention to our body is key. And so what can inflammation do? What can it create? Well, again, it goes back to this big circle of, this big process that's happening. Is the inflammation from a chronic underlying bacterial infection or overgrowth of yeast, or is it from a parasite? And all of these, and inflammation can also decrease the immune system. If we have inflammation from something else, severe GI issues, autoimmune conditions, those lower the immune system, so we have more of the potential of our immune system not being able to fight off whatever those microorganisms might be, if it's yeast or parasites or bacteria. So all of these things are a big circle. And I keep saying that, but I want you to get it. I want you to know that sometimes we don't always know what the first starting factor was, but there was a problem and it just creates all of these others and it just keeps going. So what else could it be? So inflammation can come from leaky gut. So I've talked a little bit about leaky gut. I don't want to go into it too much because it's kind of another topic in and of itself. But leaky gut is when the cells come apart and molecules, food particles, bacteria, whatever it might be, get into the blood system too soon, and then there's an immune response to it. And that immune response, as you can guess, would be inflammation. Where does that go? Oftentimes leads to autoimmune conditions. So if you have an autoimmune condition, you are already in an inflammatory state. You already have a leaky gut syndrome. So in my mind, I was talking to someone about this, I think it was just yesterday. She asked me, she has an autoimmune condition. She asked me, she said, okay, is there a test for leaky gut? And I said, yes, absolutely there is. But I'm not going to waste somebody's money to do lab testing for leaky gut when they already have an autoimmune condition. You can assume that one goes with the other. So there are other situations certainly where I would test for leaky gut because it can create all other issues as well. But with an autoimmune condition, I want to spend money where the money's is more necessary to be spent, and it's not going to be on testing for leaky gut. So let's see, beyond that, another thing that we want to think about, speaking of leaky gut, if our gut's on fire, our brain's on fire. Remember that. So lots of people have inflammation, and it could be from leaky gut, it could be from autoimmune conditions, it could be from celiac disease, and you expect them to have symptoms that come from the gut, pain and all of the things that can happen that, you can use your imagination. But so often where the problems are happening is in the brain. We have anxiety, we have depression, we have schizophrenia, we have all of these mental and emotional disorders from what? From leaky gut. From inflammation. So, which it can be from leaky gut as well. But I'm going back to inflammation. So your gut's on fire, your brain's on fire. Okay, so there is a nerve that goes from our brain to our stomachs. And so they're literally linked. So I love, one of the things that I think is a little off topic but so cool is when we talk about going with our gut. Don't think about it, just go with your gut. Well, it's kind of the same thing, really. So if you're going with your gut, it's a gut feeling, you're using your brain. It is connected. So you have the vagus nerve that goes from the brain to the gut, and what happens in the gut is going to happen in the brain and vice versa. And so oftentimes, this is a little hint, it's really cool. We can do certain things that stimulate the vagus nerve to help different situations. So constipation for one. If you are constipated and you hum, literally, I won't hum around anybody because I have a terrible voice, but if you hum, it stimulates the vagus nerve and can help motility and help your constipation. Super cool stuff and easy, and it's not a drug, it's not even a supplement. right? So it's one of my favorite things. And I had a client one time, I can't remember the song that he was singing, but he was so excited. He's like, I know all the words now, and it worked for him. It was amazing. So let's see, other things that chronic inflammation can cause, or vice versa. We kind of covered them all. I mean, it's cardiovascular disease. It's diabetes, any kind of blood sugar imbalance. Dysbiosis, if you've ever heard me say that term, that's bacterial imbalance. So we can have bacteria that gets into the wrong place in the gut that's actually supposed to be there, but it can go into the wrong place and cause all kinds of nasty issues. Of course, parasites, all autoimmune diseases, everything comes from inflammation. So the key is finding out why it's there and addressing the inflammation, squashing that fire, and then moving on to the other stuff. So this is why labs are so important. I'm going to tell you, I've had labs come back to me where I've looked at their CRP. There are several inflammatory markers, but CRP, C-reactive protein, is one of them. And I would never have guessed that they were as inflamed as they were, because they looked fairly healthy, and the issues were all mental issues. And the CRP was sky high, which is really scary. Usually when CRP is tested, it's tested due to cardiovascular issues. You usually go to your cardiologist and they'll test CRP. I test CRP on everybody because it is elevated so often. That and homocysteine, that's another one that's an inflammatory marker. If you have what the lab tells you about homocysteine, so your lab levels, being a functional nutritionist, my levels are a little bit different. And it's the same in functional medicine, but for homocysteine, the lab ranges will tell you don't want it over 11. If you have homocysteine levels over 11, your potential for cognitive decline is 100%. Okay? So I don't want homocysteine over 7. I don't want CRP over like 1. I mean, the range is really up to 3. And so we get outside of 3, we're like, okay, time to squash a fire. Homocysteine is pretty simple to get down. But I have seen it, at 13. I have one of my coaches, I think she saw it up in the 40s. I mean, really super scary stuff. So get your homocysteine levels checked, or have, if you go in and have your labs done, look at your CRP, have them do the CRP, have them look at your homocysteine. 2 very, very important inflammatory markers to keep track of. If I see homocysteine over 7 or CRP over 3, I don't care what else I'm doing with a client. Those are the first things that I go after because they're that important. Okay, so I think that's a good on inflammation, kind of a simple overview of it. It goes unbelievably deep, but that's the body, right? The body's unbelievably deep. So let me know if you have questions about this, if there's anything that I can do, if you have other ideas that you want me to talk about. Sometimes I don't do these as often as I should because I think I need to come up with a great idea. So I love to have your input and tell me what you want to hear, because that helps me and it motivates me and gets me excited to do these things. And you can probably tell that these things excite me anyway. I'm a total nerd. So let me know how I can help. You can go to my website, tastelifenutrition.com, and you can get hold of me through there. My number's everywhere. It's not hard to find me. You can also go to facebook.com. I try to put up really relevant information. I put a lot of stuff up on dogs because I got dogs, and so they're the best, and I work with dogs as well. But, I put the stuff up that I like, but if there's something that you need, let me know. So everybody, I hope you have a great day, a great evening, and we'll see you next time. Bye.